belly fat, and infertility. These conditions can sometimes be the result of modern living and bad habits. You'll learn more about on today's show. You'll also want to stay tuned for information concerning chronic venous insufficiency, a term that has gained recognition in recent headlines. Did you know it's not really about the weight scale? It's really about your belt loop. Dr. Crystal, I'm just gonna say something.
Okay.
See if you agree. I know you're gonna agree.
Okay.
Yeah, because we talked about this before. Any type of weight gain that increases your weight circumference is putting your heart at risk.
For sure.
Not just your heart, you're just at risk for metabolic syndrome.
So that's it, right? The metabolic syndrome is and when we say metabolic syndrome, we're talking blood sugar issues, high cholesterol issues, high blood pressure.
Yep.
And then you couple that with the waist circumference and the fat around the organs. We're talking visceral fat.
Yeah,
I think we should be clear about that.
It's the dangerous fat. It's the fat that really causes metabolic issues, puts you into higher cardiovascular risk. And so, a lot of times, Dr. Crystal and I, we may read to you some study about weight loss, and maybe the weight loss wasn't anything great, but there was a significant drop in waist circumference. Dr. Crystal and I are like, yay, win! And you might be like, wait, there wasn't much weight loss. But it was the waist circumference that meant something.
And I think it's so important for us to really hone in on that. And you out there, when you are doing everything that you think you should be doing, you're exercising, you're eating right, and you feel like the scale's not moving, don't focus on the scale. Focus on, as Dr. Mike mentioned,
yes.
Are you losing interest? Are your clothes fitting a little bit
Is the belt
better?
loop getting a little bit better? You know what I mean? Mm-hmm. That right there is good stuff, and it should be very motivating. Yeah. And it's not talked about enough. And so, before we even get into a nutrient combination we wanted to share with you, always remember some basic things that can really help with that visceral fat, bring down your waist, resistance training. Cardio training. Fantastic.
Movement. We can just say movement, right? We have our wellness wins. One of our wellness wins was all about walking.
Get out there and go.
Get out there, move, garden, housework, vacuum.
And while you're doing that, when you get done with that, sit down, cool off, and have some fiber. You got to get some more fiber in there.
Have some lentils. That's what he was just telling me about. Lentils now. Yeah. That's his little snack.
Listen, whole grains, legumes, lentils, all loaded with fiber.
That's my snack.
Chickpeas.
Loaded with fiber.
Make
beans,
snacks
legumes,
out of that stuff.
Nuts, seeds.
Watch your drinking. Alcohol puts that middle stuff on. And just, no more sugary drinks. It's causing problems. Yeah. Now, we want to get into, so, and we always do, you guys know, you've been watching us for a long time, food first. And that was that. Lifestyle, food first. But now we want to move into a nutrient combination. S. indicus and Garcinia mangostana. Is that how you say it?
Yeah, that's mangosteen fruit rind.
And so in combination, we are excited. Why are we excited about this, Dr. Crystal, combination?
Because it's helping to support a healthy waist to hip circumference. It's all about, it's weight management. Also helps to support a healthy lipid profile. So we like that. Yeah,
so we had a study randomized to, you had 60 overweight men and women. Half of them were put on the 500 milligram combo 2 times a day, 30 minutes before breakfast and dinner. The other half was just given a placebo. And this was followed for 16 weeks. Now they in both groups ate the same foods.
2,000 per calorie diet per day. They also walked 30 minutes per day, 5 days a week. That was the suggestion.
Yeah. Those taking the combination of S. indicus and the mangosteen rind extract, right? Yeah. They had a waist reduction of about 3.9 inches compared to only 1.5 in the placebo group.
Yep. And then the hip circumference decreased about 4.1 compared to about 2 inches in placebo. And then there was a decrease in body weight.
A nice one. Yeah.
I'll take it. That reduction in 11.2 pounds compared with just 2 pounds in the placebo group. And again, those lipid values improved total cholesterol, LDL.
Yep. Is it, okay, Dr. Crystal, this is from Google Land. Is it safe? Is and this was specifically about S. indicus, because a lot of people probably don't know that when the mangosteen rind, like I think people know mango, stuff like that, but the S. indicus this is a big question. Like, is it safe for long-term use? What do you think?
Well, it's been used in Ayurvedic medicine, traditional, for a very long time with benefits. Short-term clinical studies evaluating safety have shown that it is safe. So we, at the doses that we're talking about, it's not a problem.
Go to lifeextension.com/bellyfat if you want to learn more about that combination and a little bit more about waist circumference and why it's important. And coming up next, fertility in men. What factors should you be aware of? It was once believed that women were responsible for most failures to conceive. However, infertility is a growing concern among men. Now let's take a look at the causes of infertility in men. You have testicular problems, there's hormonal conditions, you can have sperm transport issues, and there are other causes. But I really want to talk a little bit about lifestyle. Diet is important. If you're overweight, losing some weight could help. Definitely stop smoking, limit your alcohol intake, no recreational drugs, and get a good night's sleep, about 7 to 8 hours per night. Manage stress, and a good way to do that is to stay physically active. Now, folate and vitamin E are two vitamins that do support male fertility. Folic acid in a randomized controlled trial of 162 couples, in which the men were infertile, found that 44% of couples who received 15 milligrams of folic acid daily were able to conceive, with only 22% of those who received a placebo. Now, vitamin E can be alone or in combination with other therapies, and it's been shown to improve sperm parameters. A 6-month study had, let's say there were 90 men with low sperm concentrations, reduced sperm motility, and they were randomized into 3 groups. There was a vitamin E group only at 400 milligrams, chloromethine at 25 milligrams, and a combination of both. And the results showed that the combination therapy showed the most significant improvement in both mean sperm concentration and motility, outperforming either treatment alone, with sperm motility improving to 40.5%. Now, can other nutrients improve sperm quality, like sperm count or motility? Sure. These include L-carnitine and acetyl L-carnitine, CoQ10, zinc, ashwagandha. Great choices. Now, if you want to learn more, you can visit lifeextension.com/male fertility. And coming up next, get ready to keep your legs moving as we discuss chronic venous insufficiency.
Ever since the president's diagnosis of chronic venous insufficiency, it's been all over the news. If this is something that you or a loved one is dealing with, stick around. We'll give you solutions. All right, Dr. Mike, this is our power move segment, and we have some moves. They don't look powerful, but your veins sure think that they're powerful moves that can help you push the blood.
That's what's happening. Yeah, what you're doing is you're strengthening the veins, and you're working on those valves. And when you do that, you're getting that blood out and getting it back to the heart where it belongs.
Yeah, that's right. So tap those toes or tap those heels. That's a move that you want to do if you're on a plane. That's how you keep that blood circulating. And then you also put your legs out and move those ankles all around.
Listen to the cracks and everything. It's fine. That's good. Mine were cracking the whole time.
Move your ankles back and forth. And then, of course, doing your calf raises.
Those are good ones because that stretches the muscles well, too.
Really, when you flex that calf muscle, that flex action is pushing the blood up and really helping to support healthy blood flow, getting it up so that it doesn't pull around the leg.
Last thing, walk.
Of course, walking.
Walk.
No, but I have a bonus.
What?
While you're walking, think about compression stockings as well.
Oh, yeah.
Especially when you're traveling, when you're flying, if you know you're going to be seated for a while.
They really do work.
You may need to get fitted at the doctor, and he can tell you the perfect size for you. But These are all strategies. Power up your legs. Coming up, staying healthy with our Wellness Win. Thanks for being here with us on Real Wellness. Don't forget to like the video, subscribe, and ring the bell so you'll always know when the next episode is ready for you.
All right, let's take a look at this week's Wellness Win.
Hi, I'm Blake Gossard. I got a wellness win for you. Sub in whole grain pasta when you have a recipe that calls for regular pasta. I'm making a HelloFresh meal here for the family right now. And it called for a regular pasta, but I subbed in some whole grain pasta to try to increase the fiber intake and the quality plant protein.
All right.
I think somebody knows this guy. Anyways, I love it. It's a great way to still eat the noodle you want.
Yes.
Yet you're putting back in that fiber. You're putting back in some nutrition.
Absolutely.
It's that simple.
Yes, we do. And then you donate the extra pasta to the neighbors. That's what we do. This is my husband. And I came home and he was filming his Wellness Win. I appreciate it. But that's what we do in our home.
Yeah.
We find those ways to make those healthy substitutions when it comes to pasta, when it comes to rice, when it comes to even potatoes. We leave the skin on, and those little changes, little tiny adjustments can make a big difference in the nutritional quality of your meals.
Would you like to submit a win? Well, you can go ahead and do it at wellnesswin@lifeextension.com. Hey, thanks for watching. We'll see you next week.